A little noisy. Well, thank you all very much for joining us today. I'm really pleased to be here at the Mass Vac site here in Timonium. First of all, let me just thank the folks that are standing up here with me. The county executive and Dr. Branch have been doing a wonderful job here in Baltimore County, operating this as a county site. We're very happy to partner with them to now bring in more doses and open it up to other folks and turn it into a Mass Vac site. But their entire teams have been terrific. I want to thank General Janine Burkhead, who's the head of our Equity Task Force, who's been working with all of our local community partners. It's really, as you can see, it's a great team effort from a lot of folks, from a lot of different agencies, and from county government and state government and other partners. This is a terrific site. They're doing an incredible job, and now they're going to be able to do even more people. And we thank them for the partnership. We're making really good progress. We're at 3.2 million vaccines. We did 76,000 yesterday. We registered 100,000 people in one day yesterday for the first time on the state Mass Vac site website. We're now up to 650,000. We now have vaccinated 78% of all the people over 65 in the entire state. We've done 48% of all those over 18 in the entire state of Maryland, so we're very close to 80% of our most vulnerable citizens, nearly half of all eligible citizens, and with all the efforts that everybody's doing, I think we're going to make even more success. Also was pleased today that we were recognized for being number 2 in America, African American. The White House praised us for having the best equity effort in the country. We just got a great ranking today. It's thanks a lot to the work of our local partners, but also to General Burkhead and her team and what they've been focused on. So a lot of progress, and with that I'm going to turn it over to the county executive, who's really responsible for helping to make this such a huge success.
Thank you, Governor, and good afternoon, everyone. I just want to thank again the Governor for yet another visit here to our site at the State Fairgrounds. The State Fairgrounds have been incredible partners throughout this pandemic, whether it was testing or vaccinations, mobile coordination, and logistics. So, Governor, thank you for your partnership and your presence here. We are proud that this has been the gold standard for the state and the national model, and really am pleased that there are now several sites like this across Maryland through the Governor's work and General Burkhead, both in making more vaccines available. Seriously, Dr. Branch and his team, we're proud, for example, to set up 2 more recent clinics in communities in Lansdowne and Turner Station. We have free rides to and from all of our clinics. We've set up sites in Essex and Randallstown, in addition to our site here at the Maryland State Fairgrounds. So we are making incredible progress. Over 1/3 of Baltimore County residents have received at least their first dose. Many of them have been fully vaccinated. There is hope on the horizon, and this is a big part of the reason why. So, Governor, thank you for your continued partnership. Thank you for making this a state mass site so we have additional doses to bolster the good work being done by Dr. Branch and his team. And we just look forward to continuing the partnership in the days and months ahead as we come through this. And I think we agree on Go O's as well today. So
Go O's.
Happy opening day, everybody. I think General Byrd had it this time, and then Dr. Branch.
Dr. Branch, you want to say something?
Well, thank you, Governor. Thank you, Mr. CE. Thank you, General. I guess we'll say to you that this week is Public Health Week, and I would be remiss if I did not acknowledge our wonderful public health staff. And if you ask me, and I'm asking me, I have the best public health staff in the country, or should I say, in the world. So thanks to my team. But I will say to you that we're excited about what's going on with our partnership with the state. On this Sunday, we will be having our first county-run, state-supported vaccine clinic. We got 5,000 doses, and on Sunday, we're going to give out all 5,000 doses. So we're excited about that, and we can't wait to be able to do that. So, a successful vaccine campaign and measured by not just the number of vaccines you give, but the numbers of vaccines that you put into black and brown patients. And that's exactly what we're trying to do here in Baltimore County, in the state, and across the country. So thank you all, and we really appreciate you coming out on today.
I will 100% echo Dr. Branch's comments. He's been a wonderful partner. The Baltimore County is showing us the way to go when we talk about vaccine equity. I get remarks about the number and the diversity of people coming through this site and the efficiency. And I am proud to say that the National Guard is a partner here making that happen. So, County Executive Dr. Branch, thank you so much for partnering with us and helping the state get to number 2 for vaccine equity. Thank you.
With that, we'd be happy to take some questions.
Governor, is there anything that really concerns you right now? Is it the various people not following directives right now? And do you still think you can get to some sense of normalcy by Memorial Day? I know that's something that's wonderful.
Well, so we have some positive news today in that our daily positivity rate dropped substantially for a second day in a row below 5%. Our 7-day positivity rate dropped slightly. Our case rate is down. We're still concerned that we have a slight increase in hospitalizations, particularly among younger people in their 20s, 30s, and 40s. Probably because we've nearly vaccinated 80% of the older folks that we're most concerned about. They're not getting sick and being hospitalized and dying. But now we're catching up on that. We are concerned about these variants. There are states across the country in much worse shape, including almost every state to the north of us. We're kind of holding the line, but they're red zone states at Pennsylvania, Delaware, all the way up through New York and New England, and we're right there, not in that same position. Our health metrics remain better than most of the states in the country, but we saw a slight increase. It's now starting to come back down. We're hoping that's a leveling. Our biggest concern right now is this bad news we got from the feds that they're going to be dramatically slashing our supply of vaccines, which is something we don't need as we're trying to get more people vaccinated, but hopefully we'll get that worked out.
Dr. Hogan, has there been any update from the White House about that supply?
Not really, other than more bad news. So we were told multiple times by multiple people as late as late last week that there was going to be no interruption in supply. Then we were told 2 days ago that we were going to have an 85% cut in the doses of J&J, which is about an 80,000 dose reduction for us. And we found out today that that's going to continue for at least a couple more weeks. So maybe a quarter million doses short. And that's really difficult when you're got 3,000 points of distribution, all counting on more doses. Well, we've been fighting to try to make all the school systems, but particularly Baltimore City, more accountable for 6 years. Unfortunately, we don't have any control over the Baltimore City schools. We do record fund them, and have for 7 years in a row. They're the 5th highest funded school system in America, and yet the results are still terrible. And we've got to do something to improve these persistently failing schools. There's been a lot of reports about some of the just atrocious things that the children in every neighborhood deserve a world-class education. We've got to figure out who's responsible for that not happening and try to fix the problems. We've asked the State Inspector General to look into some of these problems, and those investigations are underway.
Governor, do you plan to sign the police reform bill?
The what reform?
Do you plan to sign the police reform bill?
There is no police reform bill. There were 9 bills in the Senate, many of which we thought were good. 24 hours ago, they were all torn apart and thrown into 5 bills. We got them after 11 o'clock last night and have not reviewed them, but there were some really good police reforms in some of the bills. Unfortunately, there's some terrible stuff that they kind of mixed together in 5 piles. And we obviously haven't had a chance to review them all since it's only been a couple of hours. But we're gonna take a look at each one of the different bills and see what the actions will be.
Sorry about that. Governor, the equity issue has been an issue for several months. You said now it's getting better. What do you attribute that to, if you can specifically, getting more shots to those folks?
I'm sorry, what was the first part of that?
The equity issue has been problem for a while, but you said it's getting better. What do you attribute that to, if you can be specific?
Well, so there's a lot of things. First of all, I pointed out General Burkhead and her team has been partnering with churches, with community associations, with our mobile vax units driving into neighborhoods. We've also put more vaccines into those areas. We opened up all of our early mass vax sites, with 2 in Baltimore City and 2 in Prince George's County. We opened 2 more yesterday, including another one in Prince George's County with FEMA in Montgomery County. So we're doing everything from all directions to try to make sure that we're not leaving anybody behind, and we're just doing it better than anybody else in the country. I don't know who number 1 is, but we're shooting for them.
Last question for the governor.
I have not had a chance to review that. They had 85 days to go back and forth. The Senate had 9 bills. The House had 1 bill. Last night, they turned it into 5 bills, which I have not seen. We got it at 10:45 last night. Legislature had 85 days to look at it. We have a little time to try to review to make sure, find out what they did. We don't even know.
Thank you.
Go ahead. Cherise said no. I say 1 more, Kate.
You also had some pretty strong words from the mayor of Baltimore about the local control issue.
No, I don't have any issue with the local control. I mean, Baltimore City has always had control. It's really kind of an anomaly. That bill doesn't do much. Baltimore City's had control of their police department for 50 years. We have no control, no influence, no involvement whatsoever. They hire the police commissioner, they set the budget. It's called, technically there's some antiquated language that says they're an instrument of the state, but we don't have any involvement. So we're fine with that bill. I had concerns about the mayor's comment that he was going to drastically defund police and slash their budget for 5 years in a row. And I just have a strong difference of opinion. When we have violent crime out of control and 350 murders, I think the last thing that we need to do is, you can't improve a situation by defunding it. It's like saying we're going to cut all the education funding and expect us to educate kids better. Slash funding so we can't do more recruitment, so we can't hire more officers, so we can't work on diversity, we can't fund community policing programs, we can't pay for body cams. I mean, it's just nonsensical. You're not going to stop crime with no police force.
Thank you.